As long as I can remember, I had told my parents that I wanted to be a doctor because I just enjoyed caring for people. Um, People's stories mean a lot to me, and getting to know them and helping them work through something that isn't easy is a privilege and a blessing. And I've always really been drawn to that. I did my surgery rotation and I loved it, but I still really desired the connection with patients that in some surgical specialties you don't really get. What really drew me to breast was that I would have patients long term. I'd get to know them, help them through a difficult time. We always start by going over history, talking about any symptoms they might be having, do an exam. If they've had some type of breast imaging, we go over that. If we know what's going on, we'll talk about next steps. But sometimes it's kind of more of, this is what I think is going on, and this is how we're going to figure it out. As part of my fellowship, I did training in what we call oncoplastics, meaning I'm taking out your cancer, but I'm going to make your breast look as nice as possible. And so all the surgeries I do have some level of that. Sometimes we bring in an additional surgeon because I need a little bit more help making it look nice. But all patients get the level of oncoplastics that I was trained in. I think it's important that women feel good about how they look after they've gone through their treatment. And if that means bringing a reconstructive surgeon in to give us a hand and achieve that, that's what we do. It's always hard for a patient when we've finished treatment and they just go on monitoring. They've had this really big life event that involved a lot of doctor's appointments, a lot of different doctors, and now we're starting to cut those down to simplify their life. And in a way, it feels really great to not need all of those things, but it also feels kind of scary. It's great to be able to help them from, you don't need me as much anymore. We're only going to meet this so often. And then eventually you won't need me at all. And kind of getting them back out into life. Being in Akron was important because this is where I went to medical school and I did my residency. I went away for 1 year to do my fellowship and I came right back. My husband also grew up in the area and he's worked at Akron General since he was 18. So being back in this community and giving back to it was really important for both of us, and really glad to be here and raising our family how we grew up.